Hi everyone, welcome to Nurse Pro. The purpose of this channel is to help all you to pass your OSCE, so to get a license to work in the UK. So today's topic is IV flush and visual infusion phlebitis assessment. This is one of the OSCE skill station. So this is just for sharing, and please arrange your own sequence, use your own words that help you to remember the best. And then please make sure that you check the latest marking scheme, because the marking scheme will be updated by the NMC every few months. So you must check the latest marking scheme to make sure that you get every point. So for the general steps for all stations, please refer to this video, the OSCE framework. You use the framework, apply to all procedural skill stations. Then it can help you to memorize all steps more easily and you won't be panicked. But for this video, I will just quickly go through the general steps, because the main purpose of this video is the IV flush plus VIP scale. So, first of all, number one, before you approach your patients, you need to ensure the environment is clean, the floor is clutter-free, no fall risk, okay? And then you need to maintain privacy and also dignity by closing the door and curtain. And then number three, you need to do the hand hygiene. If it's the first time, remember to do the 7 steps. And then number two, you approach your patients. You need to greet your patients, do the self-introduction and ask the patients how would you like to be called. And then you use a short sentence to state the aim of coming. Let the patients have an idea. And then you check the identity. Checking identity is very important, especially when you're giving medication. So if you're in the hospital, please check the full name, dates of birth and hospital number. If you're in the community, please check the full name, dates of birth and the full address. And then you check the allergy and you have specific questions that you need to ask. Please refer to the OSCE framework video, alright? And then you restate the aim. This time you need to give more details to your patient, and you also need to gain consent to proceed. And then you need to check comfort. You need to make sure that your patient is comfortable now, and also it's the time for you to position your patients if the task is required. And then you need to prepare your patients, physical and psychological preparedness. And then number 4, you need to prepare for the task. That is to gather your equipment and also to check prescription if you're giving medication. So today, the topic is IV flush and the visual infusion phlebitis assessment. For this task, you have 12 minutes. You need to wear apron and you need to wear non-sterile gloves. So when you are explaining the reason of coming, you can tell the patients that the doctor prescribed maybe the saline flush for you in order to keep your IV cannula patent. Okay, so I'm here to give you the 2 o'clock intravenous saline flush. This is an example. You can use your own wordings to explain to your patients the reason of coming. And then the flush, the NS flush, will be given via your IV cannula or your IV catheter to ensure the site's patency. So before you give the intravenous saline flush, you also need to ensure the IV site is patent, right? So therefore, you need to do the VIP assessment, okay? At any time you check the comfort of your patients, is having the comfortable position for you to proceed, okay? And then you go ahead to do the VIP assessment. So first, we need to understand the VIP score. We need to understand and we need to memorize it. So for the VIP score, and actually there are a lot of charts that you can refer online. It will be like this. You got a score, you got a mark scale from 0 to 5. And you need to identify patient's VIP score. So on top of the chart, you can read from these words that when shall we do the VIP assessment? Actually, every shift you need to do it. And also when we are giving the bolus injections, and also when we are changing the IV flow rate or we're changing the IV solution, every time we do these things, we need to check the site's patency. Okay, so if the examiner asks you when shall we check it, you know where you can find the answer. So there are different phases of phlebitis. First of all, 0 is no sign. 1 is the first sign, and then 2 is early stage, 3 is medium stage, 4 is advanced stage, okay? And then for the phase of thrombophlebitis, FIB score 4 is the early stage of thrombophlebitis, and FIB score 5 is the advanced stage of thrombophlebitis. So after you understand different stages, so we go through it one by one. FIB score 1. Actually, you need to get this. Either one, the patient's maybe having pain, or you see some redness on the IV site. So either one, then the patient is having FIB score 1. For FIB score 2, patients will be having these signs either 2. Pain, redness, or swelling. Either 2 will do. And then number 3 is all 3. Patients will have all these 3. Number 1 is the pain along the path of the cannula. You see the pain is exaggerating, not just on the IV sites, but now it is along the path of cannula. And then redness. The redness is extended to around the IV sites, not just at the IV site. And then you will see swelling as well. So all 3, you will have FIB score 3. And then for FIB score 4, you need to have these all 4. One is pain along path of cannula. The second one is redness around site. And then number 3, swelling. And then number 4, palpable venous cord. You need to remember all these. Okay, so this time, palpable venous cord, this sign is added. So you need to remember all these. If all 4 exist, then FIB score number 4. And then for FIB score 5, patients need to go these all 5 signs. Pain along path of cannula, redness around site, swelling, palpable venous cord, and paresthesia. If it's given in your question paper, then you will know if patient is having fever. Please ask your examiner the temperature of your patient. So for you to get these points, you need to remember all 5 signs. Okay, so after we know the score, you need to act accordingly. The table on your right hand side, you see there are 3 main colors: green, yellow, and red. Okay, just like the traffic lights, we got green, yellow, and red. If you are having the green color and the yellow color, you just need to observe the cannula. But if it is red color, you need to recite the cannula. Alright? So the color helps you to remember. And then for number 5, you need to initiate treatment first before you recite your cannula. Okay? So these are the different stage and the appropriate action that you need to do. In your scenario, you need to do the assessment. The IV site assessment, you need to give the FIB score and you need to act accordingly. So after you get the FIB score, and because for this station you need to give the IV flush, so if you are having a green light or yellow lights, then you just tell the examiner the FIB score is 0 or 1, so we just have to observe the cannula. So then you can leave your patients and then you gather your equipment. But in case your scenario, the FIB score is 2 to 5, then you need to tell the examiner that I need to resize the cannula. I think the examiner will say that the cannula has been recited, has been changed, because you don't have enough time to change the cannula and it's not tested, right? Okay. So after that, you need to check the prescription of the saline flush. It is a kind of medication too. Okay. So you read aloud the whole prescription. 5 right is the right patient, right drug, right dose, right date, time, and frequency, right route, and make sure you check the allergy. Just an example, ABC is admitted to the surgical ward and she requires her IV flush as below. Date is today, time is 4 o'clock. You read aloud the whole prescription order Patient's name, ABC, date of birth, blah, 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 hospital number, blah, blah, blah. Patient is allergic to blah, blah, blah. The drug is 0.9% sodium chloride flush, and then the dose is 10 ml, for example, okay? And then the route is IV intravenous, and then date is today, time is 4 o'clock, but not yet given. No one has signed it yet, right? And then prescribed by Dr. XY, you said today. So you check the 5 rights and you check the validity, you check the prescriber name, prescription date, and not yet given. So the prescription is completely valid and eligible. Then you need to get a clean tray, and then you put the prefilled normal saline syringe on top of your tray. But before you put it, you need to check the drug name, the package is dry, intact, and undamaged. Check the expiry date, and check the solution is clear without precipitate. And then you bring 2 alcohol wipes. So this is the prefilled normal saline syringe. And then you need to return to your patients, but please do the hand hygiene first, and then you wear your apron, and then you prepare a pair of gloves. Because you still need to do some arrangements, so you can prepare a pair of gloves and then wear it later. But if you can ensure that you won't touch anything and you won't contaminate your gloves, then you can wear it at this moment. And then when you're back to your patients, gain consent to proceed, check the identity again, and then check the allergy again. And then just before the injection, you need to check the injection site. You need to double confirm that the cannula site is good, is suitable for the NS flush injection, and there is no sign of phlebitis, okay? The FIB score is 0 or 1, okay? And then you do the hand hygiene and you wear a pair of gloves. Okay, so when you inject your saline flush, first of all, you do the site disinfection. You use the alcohol swab to disinfect the needle-free cap for 30 seconds, and then leave it dry for 30 seconds. And then afterwards, number 3, you connect the syringe using ANTT. ANTT means aseptic non-touch technique. Make sure you won't touch the needle-free cap, okay? And then number 4, you need to inject it with the pulsating action. That is to push and stop, push and stop, push and stop. This is the method used to give the IV injection, so that you won't flush something like blood clot or some thrombus into the patient's circulation. So when you are doing this push and stop method, make sure at the same time you ask your patients, are you feeling any discomfort? Are you feeling any pain? Okay? So this is point number 5. Ask if any pain is felt. And then after the injection, you disconnect, and then you disinfect, and then also you do the waste disposal, followed by hand hygiene. Quickly document your medical record, sign it with your initial, and then write the date and time. If there is a table asking you to write the administrator name, remember to write it. After that, you reassure your patients, you ensure the patient is comfortable after the procedure, and also you remind your patients not to touch the cannula. And also you need to educate patients on the signs of phlebitis. So you may tell your patients, if you feel pain on your IV cannula, IV site, or you see some swelling, redness, or you palpate something hot at your IV cannula, please press the bell and let me know. Okay, something like that, yeah? So then you're going to end the station. Before you leave your patients, make sure you give a call bell to your patients and ask the patient to press the call bell if they need any help. And also you can ask if the patient has any concern, anything that you can help with, okay? And then you dispose the waste with hand hygiene, and then you clean the equipment. For example, the tray, you just need to state it out. You just need to verbalize it. And I will clean the tray with alcohol wipes and make it ready for next use, okay? So the code again: prioritize people, practice effectively, preserve safety, promote professionalism and trust. Alright, this is the end of the IV flush and visual infusion phlebitis assessment. So remember, you need to be familiar with the Phlebitis assessment. You need to understand all points. You need to remember all 5 points: pain, redness, swelling, and then the palpable venous cord, and also paresthesia. So, and also you need to understand the action that you need to take. You need to act accordingly. You need to calculate the VIP score correctly. And also you need to complete your skill stations. You need to use the pulsating action, the push and stop method to administer the IV flush, okay? And make sure you need to sign. Okay, hope this video is useful and hope you all can pass this skill station easily and don't panic, okay? So if you find this useful, please like this video, subscribe to the channel, and see you next time. Bye!